Thank you, Dr. Rosen, and it's such an honor to speak to you all here today. Thank you for being part of our research program. So I'm so pleased to share with you the care ecosystem, which is a new type of dementia care that we developed here. At the UCSF Memory and Aging Center. So this new type of dementia care leverages innovative technologies to provide care that is continuous, proactive, and personalized. We've designed it to be economically feasible, and in this way we hope that Medicare and other payers will be interested in scaling our program after the study is complete. But before I tell you more about the care ecosystem, let me explain why I think it is so badly needed. About 60% of patients with dementia in this country are diagnosed by their primary care physicians, and the majority receive most of their care from primary care physicians. Now, primary care physicians often lack the time, the resources, and the specialty training to properly care for patients with dementia and support the family caregivers. This means that most dementia care in our country is intermittent, reactive, and crisis-oriented, and generic, ignoring the unique situation of each patient and family. We think that we need major changes to dementia care in this country. We think that dementia care should be continuous, a process that starts at the time of diagnosis and continues throughout the disease, so that the family caregivers and the patients can access the information and support that they need when they need it. We think that care should be proactive. We want to help caregivers and patients plan ahead for future challenges and deal with problems before they become emergencies. We also think care needs to be personalized, tailored for the needs of each patient and family. So with this in mind, we proposed our new type of dementia care to the Center for Medicare and Medicaid Services, and we were awarded a Healthcare Innovations Award. The goals of this new program are to understand the needs of dementia patients and their caregivers, and to study the effect of this new type of dementia care. So we're just starting to enroll patients and caregivers into our program. And let me explain what would happen if you enrolled in our program. First, we would determine if you qualify to participate. A patient needs to have a diagnosis of dementia to participate. It can be any type of dementia and any stage of dementia. The patient needs to have Medicare or Medicaid health insurance. Also, the patient needs to have a caregiver who agrees to participate. We will be enrolling both the patients and the caregivers into the care ecosystem. If you meet our criteria, then we'll conduct a phone survey with you. That takes about 30 minutes. This will be mostly with the caregiver, but also with the patient if the patient is willing and able to help with the phone survey as well. After the phone survey, we will randomize the patient and the caregiver to either survey of care or navigated care. So we plan to enroll about 700 patients into survey of care and 1,400 into navigated care. So that means if you agree to participate, you have a 1 in 3 chance of being in survey of care and a 2 out of 3 chance of being in navigated care. Both groups are very important, and we hope that most of the patients and caregivers who join our program will stay in the program. What will happen if you're in each of these two groups? If you're in survey of care, we'll ask you to complete a survey every 6 months for as long as you stay in the program, which could be up to 3 years. So this survey takes about a half an hour, and the goal is to understand your experience with dementia. You'll receive your dementia care as usual. There'll be no changes to your dementia care. If you are enrolled in navigated care, you'll be assigned a care team navigator. Now, the care team navigator does not have formal medical training, but we train them in how to deliver our model of care. The care team navigator will work with you mostly over the phone to connect you with community resources that are selected to meet your needs. The care team navigator and the rest of our care team will support and supplement your relationship with your primary care provider. The care team navigator will triage medical issues as needed to the rest of the clinical team, which includes pharmacists, nurses, and social workers who are trained in dementia care. Our care team will work with you on 3 primary areas of care. This includes caregiver support and education. We will provide educational forums, connections to community resources, and guide in behavior management techniques. We'll provide decision-making support, proactive medical, financial, and safety decision-making guidance that expresses the patient's values. We'll provide medication support. We'll have a pharmacist who's an expert in pharmacy for dementia patients review medications and keep track of medications as they're added or changed to make sure that they are most appropriate for the patient. In addition to working through these modules of care, the care team will also be available whenever you have any questions or problems related to dementia care, so you can call your care team navigator for help. We've developed the dashboard, which is a workflow management tool. Just like how a salesperson will use a workflow management tool to keep track of the needs of their customers, our care team navigator will use our dashboard to keep track of your needs so that we can provide care that is both efficient and personalized to you. We are also developing a family and patient-facing portal. So this is a portal that you can access on your desktop computer, your smartphone, or your tablet computer. And you can use this portal to communicate with your care team. You can use it to receive educational resources that are selected for you. And you can use it to explore and document your medical advanced care preferences. It's important that we measure if the care ecosystem navigated care program is successful. And to do this, we will measure your quality of life, your satisfaction with the care, caregiver stress and burden, and also total cost of care. We hope that we'll be able to reduce avoidable emergencies and, by supporting caregivers, help them keep the patient in the home longer if that's what they want. We have a large and growing team to run this large study, and I'm just going to introduce you to 3 members of our team today who are all here and are all available and looking forward to answering any questions that you have. Sarah Delaney is one of our nurse managers. She's in the back over here. This is Sarah. Jennifer Marilise is the director of our clinical program. And Julia Hunis is our first care team navigator. So please come up to any of us, ask your questions. We have a sign-up sheet and brochures at the first desk. Please sign up if you'd like us to call you, and you can learn more that way as well. Thank you very much.